Initiatives for Progressive Change brings you Sauti ya Jamii Talk Show.
Welcome to a panel discussion on policy, budgeting, and SRHR advocacy with Marsabit County officials, youth, and religious leaders, made possible by Faith to Action Network and IfPC.
We are delighted that this was a timely session, workshop to engage as faith leaders, as CSOs, ambao tunashirikiana sana na jamii zetu. Kwa hivyo tungependa tuanze hii session.
Bado tunashuhudia ukeketaji, bado tunashuhudia kina mama kufa, vijana kukosa services in our health facilities. Kwa maoni yako, unafikiri kuna shida wapi?
Kwa maoni yangu, nafikiria shida kubwa haswa iko kwenye serikali, kwa sababu sisi hatuoni pia kama CSOs tunaungwa mkono kufikia watu haswa waliopo mashinani. Humu mtaani watu wanapata taarifa labda ukeketaji umepungua, lakini ukienda kule mashinani watu hata hawajui madhara ya ukeketaji ni nini. Na tukienda kwa hospitali zetu wakati mwingine pia kupata huduma ama kupata hospitali yenyewe inakuwa tashwishi. Kwa mfano ukienda pahali kama let's say kule North Horr Sub County, places kama Saru kule mbele ukipita Konye, utapata watu wanaishi mbali na huduma za kiafya. Sometimes kuna outreach, watu wanakuja kuwasaidia, lakini how effective is that outreach in ensuring that the women receive postpartum care? How is it effective in ensuring that they access every medicine they will need? Because even in our health facilities, we do not have sometimes the medicines that we need. And then when it comes to maternal mortality, our people are even afraid of going to the hospitals sometimes. They still don't know the importance of going to the hospitals. I remember someone told me, oh, ukipata labor pain, usikimbie hospitali, unajua madaktari wanafinya watu tumbo. And that was someone telling me that, you see, in this generation. So there is need for sensitizing people so that they will understand the importance of sexual reproductive health, and also the government to ensure that we reach to the grassroots so that people can access these services. When people in the grassroots are reached with information, they will stop FGM. And also when we target the community gatekeepers, because the community gatekeepers, that is our council of elders, they have a say in everything. If, for example, I am a Gabra, Aborana, Rendile, or any other community in this county, if our council of elders says that we stop FGM, this should be stopped in our community.
Yes, for sexual reproductive right in Marsabit County, we need a policy. You know, we have been doing a lot of advocacy, we have been doing a lot of awareness, and there's also a need for, policy implementation. There's need for also policy awareness. Kwanza hii policy yenyewe wananchi wanajua, so there's need for sensitization on the policy so that our community can understand that this thing is, is a law, ni sheria. So when it comes to a law, si atile unataka kama utaki. So until to make it as a, as a law, then people will disregard it. The other thing is, our people is the culture. People believe in, they respect the elders. So for Borana community, there's a time, the Abagadas from Ethiopia have declared that FGM is illegal. So, and the Borana also from this side listen to them. So there's also need to bring even those elders to this side of Kenya, so that these elders from this side can also affirm to what they have said. That they are the leaders who have been instigating issues of FGM, and now they have said it's illegal. So there's need also to sensitize the community, even when it comes to the law of the community now. They have said it's no. So if the community themselves have initiated and said that this thing is illegal, then also the government has to step ahead.
Bwana Sheikh, my next question goes to the faith leaders. At one point, people acknowledge you. Wanawasifu sana ya kwamba tukienda kanisani, tukienda kwa msikiti, tutasikiza mambo mengi na elders wetu, our leaders, church leaders, our religious leaders wakituhamasisha, tunasikiza sana. You are great influencers. But at the same time, the public has always accused you for covering some of these issues. Tunajificha kwa sheria za dini. Na sisi tumeakusiwa ya kwamba tunajificha ndani ya dini na tunaendeleza hujuma juu ya wanawake na mambo ambayo tunataja hapa. Mnaweza sema nini? What is your role? How have you influenced negatively or positively? Tunaweza anza na pastor.
Kwanza kabisa nashukuru Mungu. Sisi kama watu wa dini tukisoma hata katika Biblia wanawake ni wa muhimu sana. Tukisoma hata historia ya Esther. Esther alikuwa ni mtu mmoja ambaye alikuwa anafanya advocacy. So wale watu wanasema tunajificha kwa Biblia, hatujifichi, kwa sababu yale tunajifunza mahali hapa yale haipingi neno la Mungu. Sisi tunasema hadharani, tunafunza watu. Na personally I wrote about the role of women in the Bible in connection to the role of women in the entire world. Na kwa yule anataka kusoma, niko na hicho kitabu, na tuna value sana wamama, na tuna value sana wasichana. Kwa muda mrefu hapa katika mji wetu wa Marsabit Interfaith, tulikuwa watu wa mbele, na pia yale hata tunajifunza mahali hapa practically, hata yale tumejifunza hapa director aliona wakati tulienda public participation, tulikuwa pale. Hata wakati watu walikuwa wanapiga kelele, tulikuwa tuna apply the same way. Yale tunajifunza hapa wakati tunafanya kabla ya sermon, we take time, tunahamasisha watu, hatujifichi.
Asante sana. Tumeambiwa dini ya Kiislamu iko na itikadi kali sana ambayo inafinyilia kina mama wasiweze kuongea, wasiweze tafuta haki zao. Utatueleza vipi?
Mtume wetu anatuambia kila kitu inaenda na hikma, na considering the localities vile tunaishi. Unajua vitu vingine inakuwa ni ngeni sana kwa watu wetu. Waislamu kwa mfano, ukienda kwa household na umwambie mama fulani, pengine unaomba mtoto wako asitahiriwe ile FGM, itakuwa ni shida. So mtume wetu anatuambia tunatumia hikma. Huwezi kumwambia direct, unamwambia polepole. Na unaweza kujua mtu inachukua wakati. Na hii ukijaribu kuangalia Marsabit vile tuko ni very vast, na hatuwezi fika mahali mengi. So lakini through faith to action tulikuwa na hizo radio programs ya kuhamasisha wananchi mahali tulikuwa. Kwa mfano nikienda Jangwani leo, ule Muislamu atakuwa ile atanisikia. Na kama asingekuwa na hiyo kama hatungewezeshwa hivyo, hatungesikika. So vile madam alisema ni ukweli. Wengi wanatulaumu kwamba tunajificha kwa dini, lakini hatujifichi. Dini inataka kila kitu iende polepole, tunajaribu kuhamasisha wananchi, na kwa hayo tutaendelea kuhamasisha. Kama vile mwenzangu amesema, vile pastor alisema, kwa muda wa siku 5 tulikuwa hapa. Lakini wakati tulipotoka hapa tukaenda kwa public participation, yale tulijifundisha kutoka hapa ndio tulitumia wapi? Pale. Kwa hivyo tunawashukuru sana, asanteni.
Madam Mokaya, dada yetu mwana youth alianza kwa kusema the gaps we have in the health care service provision ni kwa sababu ya uzembeaji wa hii idara, ambapo ya kwamba watu wetu hawahamasishwi, na mara kwa mara pia hatupati services zile tunatarajia hata tukijaribu kuja katika hospitali. Tutasema nini juu ya Marsabit County?
Okay, thank you so much. I just want to respond to what my sister here has said. Marsabit County is vast, as we have earlier said. These are vast county. You can imagine our farthest facility is over 550 kilometers from here. And the facilities are really distributed across all the 4 sub-counties. And in each of the sub-counties, we have a representative or a healthcare worker who is working. But then the nature of our community is also challenging, because these are a community that is moving from one area to another in search of pastures. And what the county government of Marsabit through the Department of Health Services has done is planning with the stakeholders, like the NGOs, mapped the areas that had no health facilities, and the mapping is to bring the services closer to the community, and that is through integrated outreach. And that is what we have been doing. Those areas that have no health facilities, they are those mapped sites that outreaches are conducted. But basically, this time we are also hit hard because resources are always constrained, and some, in fact, almost 90% of these sites currently are not covered because of the issue of finance, that also the partners have really scaled down their services because of lack of funding. But then on the issue of, people coming to the facility and they are not getting the services, all the health workers that have been employed are those ones who have gone through the training and they are qualified. But from time to time, we might be having stock out of some of the commodities, and that the department usually do their orders and do a follow-up. I cannot really deny that there are challenges. The challenges are there. We are really also experiencing a lot of challenges in terms of, everything is tied to a resource, and resources are not always enough. But what we have done is integrated outreach, training of our healthcare workers on specific areas. As you can see, some of the health facilities have been constructed and they are open. That means we are bringing services closer to the community. And also, if you can attest, some of us can attest to that. We have been working very closely with the religious leaders and CSOs, and supporting also this team to go to the radios and do a lot of advocacy. So we have also been through, in partnership with some of the partners, we were also able to reach what we call the community health structures or community health promoters, and they have been trained on SRHR. But then we have over 114 community units. We still need to reach more community units, more CHPs, more health workers for the training. So basically, as much as we are really working hard, we still have those gaps that we need to put up our synergies together, our effort together, and provide these services. Not only services, but quality services to the population of Marsabit County.
Thank you so much. I'll go to Director. We are talking about resources and resources and resources. Most of these functions, county functions, have been deployed. We only get funds from national government to county government, and we expect services, the county, to be super good for the sake of the community. Where do we go to? Because now the ball stops at your gate.
The government has, let's say, budget constraint nationally. And an exchequer release is given through the Commission for Revenue Allocation to each counties. It's determined at the top level, using their own formula based on the HDI, the Human Development Index, poverty, based on population. So they have different parameters to determine that. Then, and they follow a regional commitment. If you remember in April, I think that's through 7th April, 2001. And I think there has not been declaration as such up to date that 15% of the total budget, AU decided that 15% of the total budget, that was in 2001, 7th April, that at least 15% of the total budget should go to health sector. Abuja, it's called Abuja Declaration. If you Google just Abuja Declaration, that at least for an organization to operate, at least 15% of its total budget should go to health sector. So nationally, that's what's happening. We are at around 21-23% of our total budget for the national government is going to health sector. Let's now go back to our context. That's Marsabit County. I think we tried because it's at least 15. We are giving 26% of our total budget of the 8 billion to health sector. So how the budget process works is, as I explained earlier, is we give a blanket based on the number of recurrent expenditure they have, and the development, we usually give a blanket to the department to decide on what are their key priority areas. So as a sector, yes, we know there is budget constraint nationally and at the county level, but now determine what specific itemization of the budget they need, that's at the department sector. But our total budget around 26%, and that's the limit we can go, because we have 10 departments, and based on most of these departments, there are other declarations for agriculture, for water. So we have to also fulfill those declarations, at least even if it's the minimum set requirement. But now for health, we surpassed it with around 11%. And if we maybe get an increment and our own source revenue increases, we'll definitely increase. Those are the first, there's the key sectors. There are 4 of them that we usually concentrate more. That's water, health, food security, and yes, I think food sector and roads, the infrastructure. Those 4 sectors have highest of our budget. So I think, yes, there's constraint, but in terms of health sector, we are doing fairly good in terms of giving the budget. But now the problem is they have a lot of workload on themselves in terms of recurrent expenditure, maintenance and operation. So it's not enough for them because we are giving around 2.5 billion of our total budget to health sector. And huge of it, around 60-something% is going to recurrent expenditure. And that's why maybe I agree with the lady who said that at times maybe the infrastructure at the most local level, and Marsabit is the biggest county in Kenya currently. It's the biggest out of the 47, and it's one of the marginalized counties earlier. So we are trying to catch up with the rest. So I think going forward, we'll still, if our exchequer releases increases, we'll still improve. The national government increases our funds. I think health sector, based on our own formula we have, will be.
Bwana Director, just a follow-up question on the same.
Yes.
Sometimes the issue is not about the percentage of the allocation.
Okay.
Sometimes the issues are around timely disbursement.
Okay.
Unajua hata ikiwa ni kidogo, lakini umepewa kwa wakati unaokufaa, inaweza kukusaidia. Kwa hivyo the citizens of Marsabit feel hata kama ni hiyo kidogo, kwa nini inakuja baadaye wakati ambapo tumetabika, tumehuzunika, tumeathirika,
Yes.
Mambo kama haya. Why can't we get it on time?
Yes. I think the issue of on time is between the controller of budget and the national government, because currently we are at the November disbursement and today is February. That's why our salary, the last salary they received was for December, up to date, because we have only received November disbursement. So the national government is in cash crunch. They are releasing bits by bits, and there's a lot of bureaucracies between, because it's in law it's supposed to be 21 days from the request. I can make request today and receive after another 3 months. So the bureaucracies between the controller of budget, the national treasury, back and forth, and the documentation, I think there's a lot of bureaucracies there. But once it reaches the CRF, the County Revenue Fund, for us even disbursing in 1 day, even 1 day is a lot. Even 5 hours is okay for us, because it's just a matter of, because all of it in the IfPC system. So all the request is in the IfPC, so to just request for the drugs or anything, but now even receiving from the national government can take you 3 months for a single request. And you're supposed to make 12 requests. Even not more than 12, on minimum 12 in monthly basis. If you go in weekly basis, that's 52 weeks, 52 requests. So at times now, even because sometimes at the end of the financial closure, that's on 30th June, and we receive our disbursement for May in August, after even the financial has ended. So it's from the national government side.
Kwa hivyo tutapata mechanisms za kuelimisha the public.
Yes.
Ya kwamba saa zingine lawama sio yetu, ni pia tunategemea the bureaucratic process.
Yes, and maybe another approach is like the question that is always posed to the government: when the donors are not there, what do you do? I always pose when the national government exits. It doesn't exist, but when it exits and it says that the national government will not be working, and you want the counties to work, what do? You depend on yourself. So how can we generate locally our own source revenue? Because if right now I'll be generating a 7 billion source revenue, I'll not be needing the national government. Because if 94% of our budget is financed by the national government, so you only hand to mouth. It's just like when US said, was it 2 weeks ago, when Trump signed, it was just hell, and health sector was the most affected, both at national and at the county level. So I think there should be a mechanism on first increasing our own source revenue at the local level, and that will also increase, even if the national government will be there, our disbursement to a greater level.
But Director Public Health, we don't feel public health. That's what wananchi say. Wanashangaa public health ilimezwa na health, ama ina exist, ama inafanya kazi gani, ama inatusaidia vipi? Kwa sababu hatuelewi tofauti, mara kwa mara tunapotea, na tukitafuta msaada kwa public health, bado ni kama msaada upo haupo. Tuelimishe kidogo.
Public health is fully alive and it is kicking, it is working. If it is not working, we shall be struggling even with cholera. Right now, we don't have cholera. We don't have diarrheal diseases. If public health goes down, you will see something like outbreak of cholera, other diarrheal diseases, malaria outbreaks. So it is really working. But the problem, it's not only this county. The country itself is focusing on curative rather than preventive. The focus globally, regionally, locally, we are focusing curative rather than preventive. So resources allocated to preventive activities are limited. In fact, it's like they are not even there. As I speak, the last time public health officers were employed was 2019. From 2019, there are people who are retiring, there are people who are exiting the service, and we expect these activities to go on. So, I think if we really need to focus on prevention of diseases, we will even limit the expenditures in our facilities. If we are to work optimally, we will require something to like 5 billion as health sector. So if we are given only 2.1 billion, is just way below our requirement. That is why we are striving, we are struggling to give all services to our citizens. Health is a human right issue. Our Constitution, 2010, Article 46, the Bill of Rights, guarantees provision of standard care of health to our citizens. So it is something we need to do. We are obligated by our Constitution. So it's something we need to do. So resources are constrained. That is why we are really struggling to offer these services. 80% of our diseases we are struggling are preventable diseases. Only 20% it requires surgical, the issues of doctors and all that surgical. But the country, even the one is not focusing preventive measures, prevention or preventive medicine.
So Bwana Director, wacha nikurudishe kidogo kwa your role as a public health director in Garissa, in Marsabit County, in terms of now supporting the young people to access SRH. What has been your role and what are you proud of that you can tell these people you have done as a sector in the Department of Health?
One, from time to time, we've been going to our FM stations to educate the members of the public, including our youths. Youth are members of the public. So we have been going to our FM stations, and we've been discussing some of these topical issues, whether mental health, whether HIV/AIDS, whether reproductive health. So we've been going to the FM stations to give out. We've been having engagements at a community level even. We have 1,983 committed promoters in this county. They are in 114 community units. So they are in the villages giving out some of these messages. These guys, they have been trained on basic modules and they have been trained on technical modules. These technical modules include HIV/AIDS, TB, mental health, malaria, and all that. So they have been trained. So they are giving this.
What efforts have you been making as a young person, a young woman, standing for the rights of your fellow young women in terms of access, in terms of advocacy? What is your stand and what will you tell the public in terms of engagement to ensure that we increase even the budgetary allocations?
Well, my call to action to the youth and to the duty bearers is that we prioritize areas of advocacy, prevention and response to GBV and other harmful cultural practices. For instance, in our culture, we know that cultural norms are a barrier to us. In our communities, they believe that if you don't beat your wife, she will grow horns. So it's like wife beating is the order of the day. Sindio, is it true or false? It is true. Unfortunately, even women themselves believe that, some, not all of them, believe that if their husbands don't beat them, they don't love them. So these are some myths and misconceptions and harmful traditional practices that we need to outgrow. So it is also important for the county government, specifically the budget department, the finance department, to allocate funds for community sensitization, so that we can prevent and respond to GBV. We don't have to wait for people to die. We know what happened 4 weeks ago when a man from Badassa killed an expectant woman. His wife was expectant. He has been threatening her. Physical violence was the order of the day in that marriage. Unfortunately, on that fateful day, he killed her. He stabbed her several times, and that torture happened in front of the children. And right now, I wonder even whether we as government, CSOs, and anyone is thinking about the mental health and psychosocial support for those children, because we've been trying to also approach the Department of Children. Those children need support. Women who have been going through GBV, they need mental health and psychosocial support, because the children who grow in that house will grow in trauma. They'll be afraid. Some of them will be afraid of even marriage. So I am calling upon the government and also the youth so that we continue to advocate for allocation of funds. It is not only the duty of CSOs to advocate for gender equality. As a government, as a health department, everyone has a role to play. You don't have to wait for someone to be injured or to die so that we start responding, going to the social medias. Why don't we stop before it happens? Because in our culture, sometimes even when people are getting married during the traditional wedding, at night, there is this advice that the girls are given. And unfortunately, you will hear someone saying, I give you my daughter, you can do everything you want with her, you can beat her, insult her, but don't insult us, the in-laws. You see? Yeah, in Talia Sikeni, the one factor, Nuar Sodani, to Kimpuga Modan. Even in this generation, that is what parents, the message they give to the man. Really, this is not fair. And as people who are here, we need to talk about that. When it comes to sexual reproductive health among the youths are afraid of even going for condoms to the dispensaries and hospital. What are we going to do? Because people will say, oh, you know, so-and-so's daughter or son is a prostitute. How can we change the mentality? Okay, they're not going for this family planning. They will get pregnant and then they are excommunicated. Because in some of our communities, if you conceive before marriage, you will become an outcast.
Thank you.
Okay, maybe just interestingly, I agree with most of the voices, but in the last KDHS, and I participated in 2014, we designed the questionnaires,
The recent one, there was a funny question that how many women will allow your husband to beat you? Unfortunately, Marsabit County had 79%. What? Yes. And the reason was very shocking. And okay, of course, when they released, they called us in one of the hotels, Upper Sun and Rock, and I questioned the sample size of the data. The sample size was too small. But even the too small was very funny because the answers were around 6. The following reasons: will you allow your husband to beat you because of the following reason? Coming to home late. The second one was denying him sex. The last one was burning food. And burning food had 89%. So I was wondering how, in the respondents, out of around 60 respondents, like 50 something of them, they said they will allow you to beat you if you burn food. So, yes, if you go to the KDHS, it was very funny. We got the metadata, the raw data, the metadata, we were analyzing the metadata. So I was like, how did they come, even if you would have said other reasons, even like sex, like having other issues outside marriage, I would have allowed that. But now burning of food being the highest. So I even asked, did the respondents be men? And then they camouflage. Did you do through phone interviews? I was asking them, did you do through phone interviews? Wakajibu hiyo, akichoma chakula tutachapa hiyo vizuri. You see something like that. So, but the one she said on cultural practices, like the one when you marry, you can earn it, even they said bitter, but do not injure her. So it's like I've given the right to bitter, but not injure her.
The issue of GBV or any other harmful traditional practices, our major issue is at the community level. People are not coming out to report. But for the health indicators, yeah, those are the indicators that are reported very well.
As a CSO, as a faith leader, what commitments do you have towards enhancing SRHR in Marsabit?
As you have said, my name is Sheikh Bashir Somo. I'm the current Marsabit Secretary General, Marsabit Interfaith Council. And as far as religious leaders are concerned in Marsabit County, we have to give them capacity building as far as sexual reproductive health is concerned. Because as far as we are talking about the life after death, also we have to sensitize our community on how to live in this world in a way that they will live with harmony and tranquility. But when we say that religious leaders, this one is not our field, then we'll be at a loose end. Definitely, our religious leaders need to be capacity built. They need information. And when it comes to passing information to the community, we have platform. You know, as far as religious Muslim community is concerned, we have 5 daily prayers. Within this period, religious leader can have an opportunity to talk to the community if they have this information and if they have been capacity built. Maybe when you want to call them to teach about uptake of family planning, most of them, they don't agree with you. Why? Because they don't have information on this. But when they get, trainers from national level, as the way Faith to Action have done, we have been given information, training several times. We have been brought there at a national level, interacting with those religious leaders. Then when we came to our area here, we do dissemination because we have this information. Then we talk to our communities, and the uptake nowadays is going well in our community. And when it comes to early marriages, as religious leaders, I'm the one who is conducting marriage, I'm giving marriage certificate, and I'm the one who is conducting nikah. So before, when we are doing this nikah, the boy was there, the man who is married was there. But most probably the lady, she's not there. We don't even know which kind of the age of that girl. But nowadays we have changed because we want the ID photocopies. We are doing referrals for them to pass through test, HIV test. We want to know the age assessment, maybe from the doctors. When they come with those documents, then we'll tell them they are free now for us to conduct this marriage certificate. To give them marriage certificate and to conduct this marriage.
Thank you, Sheikh Bashir. Pastor, I'm interested to see how your partnership is within Marsabit County in terms of faith leaders, the county government, and civil society. Because once we do not have this level of partnership, then we are bound to speak on different levels. So what do you make of the partnership in Marsabit County, especially in terms of dialogue with the Muslim community and Christian community How has it been strengthened?
We have a good coordination with the Muslims, our brothers. Here, Sheikh is our secretary. I am the executive treasurer, and we have a good connection with even Catholics.
Do you hold dialogues even?
Yeah, we have a dialogue, not only with the sheikhs, even with the security sectors. Right now, I have all the phone calls for county commissioner, police commander. Whenever anything happens around us, I used to call them. So we have some of the directors, even doctors, we have their phones. So in Marsabit, we have a good connection, which has really helped us for a long time. And
that's a nice long-term sustainability.
Yeah.
I hope you can carry it forward.
Very well.
Thank you so much.
You know how Marsabit interfaith did when there was negative ethnicity in our community. We stood up and talked to our community. We were the one who were leading when we were doing mediation in our community, and we also have a lot of meetings every now and then. We have dialogue. We do radio talk show when we are together at one platform. Thank you.
I'm much interested in the transparency and accountability. We are talking about scarcity of resources, at the same time talking about utility of resources. Just comment in terms of transparency and accountability, hata kwa rasilimali ambayo tuko nayo, ambayo tumepata. Tunaweza sema nini juu ya Marsabit County in terms of resource acquisition, utility, transparency, and accountability?
When it comes to transparency, I don't think we get clear information in terms of everything, and there is misappropriation of funds. Like what was presented to us today, the budget for 2025, that the toilet and pit latrine for ward admin office will cost 1.6, and that is not realistic. So I think we youths, we need also to hold the leaders accountable, and it is unfortunate that most of the youths have lost trust in leadership. That is why even today, some of them were just there, even the boda guys, they were not joining us even after we called them. They said, and then it vitu vilishapitishwa kitambo. You see, that is so unfortunate.
Okay. Okay. Yes. I would wish director, he's an economist, and that so many issues that even the youth mentioned in their public petition that they presented, getting an allocation of, for example, of 9 million for youth-related initiatives out of 9 billion, something like that. So these are the issues that we are still coming back to you. You are an economist, a planner, and we are wondering in the next 5 years, how would we want to see Marsabit in terms of strategic planning, in terms of even getting more resources? You alluded it to it yourself, that we should not be relying on the exchequer money. What are the plans in place to make sure that we can consolidate our own resources, utilize it prudently, and also cater for the needs, strategic needs of the youth who have presented their petition on so many issues?
Okay, thank you. I think, yes, maybe just a point of information. The one we discussed in the morning, it was 1 million for the toilet. It was a double pit latrine. Okay, what happens? Okay, what happens? There's what we call the bill of quantities, which is done by the Department for Roads and Public Works. Any project we give, I might sit in office and write, this house costs 7 million, but after the BQ is done, they can either take it upwards or downwards, depending on the cost of transportation, the buying materials. So there's so many factors. They do the BQs, the engineers know. So all the budget that passes must pass through the BQ stage, and then they are taken to the procurement stage. For the petition, yes, the young man who presented he was a statistician. I think on the figures of the youth, the 89% of the total population, I can say a bit exaggerated, but yes, majority of Marsabit County, I think close to 81, but it's okay, 89. But we also have the projection. I have the projection for the age groups up to 2030. I projected it. So it's a public document. I can still share with you for either for this year or next year the projection of all the age cohorts for the population. That has no problem. The only bit, yes, the budget is 730 something million. Out of that, the 600 million, he said was allocated to 6 million. When I was first approached by the CEO, IfPC, on the issue of I think the whole discussion started with IF. He's not here, Mulata. He's a good friend of mine, and we were schoolmates. So when we started the discussion of the youth, the Circle Youth Assembly, I think I've met with Circle Youth Assembly around 4 times. I've engaged with them severally and telling them the whole process of how the budget works and where we can work together and improve. After all, hata mimi niko kwa hiyo bracket ya youth. Although nimebakisha tu gorofa kidogo sana ya kupita. So I think it's my last gorofa ya mwisho within the year. Niruke kutoka si Gen Z lakini millennials. But the issue is I advocate how you did the petition to the county assembly. It's very well in order because that's the last resort. That's like the land of the last resort. The only problem is the analysis tu kidogo ya the recurrent ulikosea, because you said out of the recurrent the youth get 6 million, but youth starts from which age? To my understanding might be 18, to you might be 14. I don't know whether are the secondary students, secondary school, the A-levels, are they youths?
No, we go by our constitution that dictates from 18 to 35.
Okay.
Because even when we do other engagements, when we go with the World Bank, the UN, sometimes it's between 15 to 30. But now for our constitution, we always stick on the 18 and 35.
Yes, the reason I posed that question, a third of our budget for the Department for Education, the department is called Department for Education, Youth and Sports. A third of it goes to scholarship, 250 million. Every girl child that gets 300 marks and every boy who gets 320 and above in KCP will be taken to secondary by the county government. So we have each year fully funded. So we take 250 million out of that budget before even I release. There are certain budgets I block before even I give the ceilings. Like these departments, they are waiting for my circular to send the ceilings for each department, and there's some section I will block. Like the scholarship, I'll block based on now the data I'll get from the education sector, because currently we'll not be having Form 1s. So I'll use the data for Form 2, Form 3. Of course, now that will reduce the budget because there's no transition of the Form 1 currently because of the CBC thing. I think there's a lapse in the education sector. So they are going to grade 9. So under different sectors like health, there are sectors I'll block, like the Kenya Medical Training College, the major general hospitals, even the project, the flagship projects will be completed. So there are certain areas I'll block and give the other ceilings now for them to budget. So now the priority why I told them to do the petition both to the department and to the assembly was out of the remaining funds. Now will the education sector and the sports see that there's a need for youth engagement in the budget? And there's a time I even called for them the chief officer youths and the sports. And by being even a footballer, hata mimi mwenyewe itanisaidia. And maybe the major challenge will be between the assembly and our side now, the executive. To come into agreement, because the budget, after it leaves my desk, it will go to the department, the finance team. So in between, sasa, kuna reduction in budgets depending on the cabinet, even the cabinet approval and the assembly. Okay, but in the supplementary, after, I think through this petition, I don't know the exact amount that has been allocated because the assembly is now in Isiolo doing the final reports on the supplementary. So Tuesday, I hope, I'm on belief now, I'm now faithful, I hope that the youth, the league, especially, first of all, the league, he said league is 17 million, which is a very minute, is insignificant figure out of our budget. I hope by Tuesday, they'll have something for this year. But for the next financial year, I'll also write an addendum to the department to tell them that this is one of the concerns that has been raised in the public participation, both on all the 20 wards and at some different levels. So kindly consider the youths under this section, because they're saying 17 million can do the county league, the whole of it, which is very small for the department, leave alone the total budget.
Okay,
yes.
Thank you so much.